Colorado's latest idea to keep our hospitals from overflowing with COVID patients is not a mask mandate. It's not restrictions on indoor events. No, the state wants to put monoclonal antibodies in the bodies that have just contracted COVID. Marshall Zellinger explains why antibody treatment, unlike vaccine boosters, aren't available to everyone.
Do you live in Colorado? Yes. Are you older than 18? Yes. Are you breathing? Yeah. Then based on the recent executive order from Democratic Governor Jared Polis, you are high risk for exposure to COVID and eligible for a COVID booster. But high risk for exposure to COVID is not the same as high risk for getting really sick from COVID.
Yes, there's a difference. Let me explain.
Denver Health's Chief Medical Officer, Dr. Connie Savor-Price, will walk us through the more complicated flowchart after explaining what the heck is monoclonal antibody treatment.
The monoclonal antibody prevents those already infected from getting severe disease.
It's administered as an injection or an IV, but just because you live in Colorado, are older than 18, and are breathing, that does not make you eligible for this treatment.
Not everybody is at risk for severe disease.
Are you positive for COVID? Yes. Are you showing symptoms? If no, you're not high risk. No monoclonal for you. If yes, you're not there yet. Are you high risk at getting very sick from COVID, meaning older than 65, or overweight, or pregnant, or have heart disease, cancer, or a weakened immune system? No, no monoclonal. Yes, still not there yet. Did your symptoms start fewer than 10 days ago? If yes, you qualify. Back to the top now. What if you're not positive for COVID? Then you need to have one of those high-risk conditions I just listed. State epidemiologist Dr. Rachel Herlihy believes monoclonal antibodies will keep hospitals in Colorado from reaching capacity. Try to follow her graph. The blue section shows peak hospitalizations around the new year, more than 2,000 patients, if monoclonal antibody treatments continue at the same level as it's happening today. The green section shows a lower peak in hospitalizations if monoclonal antibody treatment increases by 50%.
If we're able to substantially increase monoclonal therapy use in Colorado, we estimate that we could decrease peak hospitalizations here in Colorado by 150 to 300 at the peak.
There are now 161 providers for this treatment if you qualify based on the flowcharts. We have a link to the map of all the locations on 9news.com. And Kyle, you didn't see it on the flowchart, but if you have a close exposure to COVID, you still have to go to the are you high risk. So you go to the same section as if you don't have COVID, it still relies on are you high risk or not before you can go and get it.
So as we know, these rules are made to be broken because the governor decided that the entire state is now a high-risk living situation, and that's how everybody's able to get vaccine boosters. Could the governor theoretically decide that everybody suddenly has a high-risk condition and next thing you know they're spraying antibodies from crop dusters or what?
I really think it's the providers are just relying on the state's guidance. And if the state health department decides everyone is high risk for this category, just like he's saying everyone is high risk for boosters, I think you could go and then the provider would be like, sure, the higher up said it's okay, so we'll do it for you.
Could you imagine if he came out and he goes, yeah, everybody in this state, low oxygen, you qualify for antibodies. Also, did that flowchart contain a Bitmoji of Governor Polis?
If you don't ask, you never know what you're going to get. And I asked his people, hey, you don't happen to have a cartoon version of the governor I could use to go with my cartoon version of me. What's it for? Told them what it's for.
Boom.
You saw it.
Do you think they made it or do you think they already had it?
They had it.
Yeah, I thought they did too. All right. Thank you, Marshall.